This is Jim Johnson with the Monterey County Herald interviewing new Salinas Valley Memorial Healthcare System CEO Pete Delgado. Thanks for meeting with us, Mr. Delgado. Appreciate the time. I guess my first question is, well, let me be among the last to welcome you to Salinas in Monterey County. Have you ever been here before? Have you ever visited the area personally?
I've visited the area before. Beautiful area. I've always remembered how beautiful the land, the peninsula is, the hills that you have here in the Salinas. Beautiful.
Mm-hmm. Have you ever been in this area professionally for one reason or another?
No.
Okay. Yeah. Now, just in doing a little background, I noticed that you've been mentioned as a top candidate for various positions in larger healthcare systems, including Cook County, Parkland, UT. So why leave LA and why Salinas Valley Memorial Hospital?
Well, I think I took myself out of the search in Parkland because I received this nice offer to be the CEO of this beautiful hospital here that we have. Why leave it is because there is so many good things happening in this organization. It's a beautiful place to have my family move and enjoy it. It's a nice area. Have you ever been to Texas, by the way?
I have once.
Oh,
yeah.
Then you would know.
All right. So you're probably well acquainted with some of the issues that this healthcare system has been dealing with over the last few years, ranging from the exit of the longtime CEO, Sam Downing, to some labor and financial issues, and then planning for the future as a standalone entity for now. What do you have anything any thoughts about where this healthcare system has been up to this point and where they're going?
Well, I think I'm the kind of guy that looks at the cup is half full. The good things about this organization is its people. We've got very committed medical staff. They're very passionate about leveraging evidence-based medicine in this community. Our quality scores are 98.7. That's very high in any kind of a medical community. And so it's viewed as a high-performing organization already. And so this is one of the better prepared hospital, in my opinion, as health reform starts folding out. And so I think the good thing about this hospital is well prepared for health reform. It has people that are very committed. Our quality of physicians are very committed as well. You've got a dedicated board that's very passionate about protecting the organization as a whole. So there's a number of pluses that the organization has going for it. I don't know about the fender benders or the bumps in the road that they've had in the past, but I like to look at what I've got to work with, and I've got a lot of good things to work with.
Well, you mentioned healthcare reform. Obviously, that's a major challenge for all healthcare organizations. But along those same lines, what is the biggest challenge that you see this system facing in the next 5-10 years?
Well, it's all about quality, service, and cost. The quality is already up there, and we need to maintain and continue improving our services. Our services here are becoming better every day. We're becoming a bit more culturally sensitive. Our processes, we put lean management in our major processes to streamline, make them more efficient. Our cost issue, we made a lot of progress in reducing our costs, reducing our waste. There's probably some more opportunities. You want to be able to get to a certain, in a very competitive, you want to be the high quality provider, high quality, low cost provider. That's where you want to be. And we're there, and we can get even better in moving and preparing for health reform. The other is getting clinically, or getting integrated a bit more with our providers in our community. And they've already done a lot of good work in getting clinically integrated. They've got physicians that are very serious about getting the outcomes and the the quality metrics, making sure that we're doing the right thing at the right time for the right folks every time they see these patients.
While you were at LAUSC,
Yeah.
you went through opening a new physical plant,
Yeah.
and that's something that the Salinas Valley Memorial will have to be dealing with in the relatively near future. Is there anything about your experience in LA that can translate to Salinas?
Well, of course, when you're building a new facility, it's a new day. It's a new opportunity to do things better, to make things streamlined more efficiently. But the hardest part of any organization, it's not about the bricks and mortar. It's the people that work in the hospital. It's the people that our community depends on. And I feel very good about what I've inherited here. We have a very low turnover, which indicates that people like to be here. Our quality is very high in this particular facility. Our physicians like coming to work. They feel safe to bring their patients. They feel that our systems are reliable. So those are great indicators for a good organization.
All right. Can you tell us a little bit about your time at LAUSC?
Sure.
What was it like working down there? And you were there for about 10 years,
That's
right?
correct. Mm-hmm.
Can you tell us, some of the challenges, pitfalls, successes that you enjoyed, you faced down there?
Well, challenges are trying to get our systems in line with the goals of the organization to be a top performer. We were just getting our quality metrics up, and I think ours was when I left, it was like 97. So that was viewed as a high performing organization. Our medical staff, we had a staff model, so they were basically on contract or employed physicians. We got them a bit more aligned than we have in the past. We worked with the community providers, specifically the primary care providers, under this umbrella or under this project called Camino de Salud. It was a way to go out into the community, work with the primary care providers, put them in front of a specialist so that they deal with operational or transfer issues or coordination issues. So there was a number of good things that we did that I'm real proud of in the hospital. It's in a better position than when I got there.
Okay. And is there anything you'd like to say about particularly coming to Salinas Valley Memorial in terms of, you going to live in the community, or you planning on, being in Salinas, or where are you planning on living?
Well, I haven't found a place. I'm going to leave that up to my wife. I know I'm going to get it wrong if my wife doesn't weigh in on this one. So that is something my wife's going to figure out. But there's so many options here. A very, very nice area to live in. So I'm looking forward to settling down.
Mm-hmm. And are you have any thoughts about how long you might stay in this position?
Well, every CEO would like to stay and leave a legacy, and I want to look at this as my last stop. Basically, I want to retire here. That is something my goal would be is to get our organization, continue the progress we're making. Making sure that we meet the needs of our community, making sure the hospital is financially healthy, making sure that we're hitting the mark and that we are the people's choice going forward. And more importantly, I want to make sure my family is happy. And so that's what I'm looking forward to.
All right. Well, thank you very much, Mr. Delgado, for your time, and we appreciate it, and good luck.
Oh, thank you.
While you're here.
Thank you very much.